Let's now turn our attention to X-linked recessive conditions. These are males with mutation that's on a recessive gene on the X chromosome, and the daughters, obviously, who have two X chromosomes of affected males are going to be obligate carriers. In many situations, depending upon the importance of that gene on that X chromosome, will tend to be asymptomatic, but not always. And the sons, obviously, the affected males, do not carry the mutation. And daughters of the carrier females are normal or carriers themselves. The sons of the carriers of females be affected or normal because the males are homozygous for the X chromosome to begin with. Let's talk about an X-linked recessive condition called Ch09 syndrome. This involves, as you recall, deficiency of hypoxanthine guanine phosphoribosyl transferase. And this is, remember, part of the salvage pathway of purines, and it's going to lead to hypoxanthine and also affect guanine. And then because nucleic acids are critical in many organs, and especially this is also X-linked recessive, it can lead to mental retardation. And because you're increasing the more uric acid production, you lead to hyperuricemia, and obviously that could lead to what? Gout. So this is a cause of gout. And the classic clinical presentation, because of the alteration of the CNS, it can lead to self-mutilation, biting off one's fingers, toes, and other appendages or anatomic structures. Then we talk about testicular feminization, antigen insensitivity, when you have a failure of masculinization of the external genitalia of XY males, and that can be a problem. Another disease we talked about earlier is chronic granulomatous disease of childhood. Remember that it's going to be X-linked because what's the enzyme that's critical for making hydrogen peroxide is NADPH oxidase, and this gene product, the gene itself, is located on the X chromosome. And basically, you're going to have an inability to destroy bacteria, so then you end up bringing in macrophages that will wall off the infection, but it'll be granulomatous inflammation, and it leads to early death because of the granulomatous destruction of the lungs. And it can lead to hypersplenomegaly and lymphadenopathy as well. Then we'll come, when we talk about immunopath, we think of Bruton, agammaglobulinemia, where you don't have B cells around to make antibodies because you can't form plasma cells, and you're now prone to bacterial infections. It involves the Bruton tyrosine kinase gene, which is located on the long arm of the X chromosome. So no immunoglobulin production, increased risk for recurrent bacterial infections as a consequence of this entity.